Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Muscle relaxants, and we're looking at some very important points. So let's look at what is a short-acting non-depolarizing muscle relaxant. So short-acting non-depolarizing muscle relaxant. So short-acting non-depolarizing muscle relaxant. So this has the gantacurium. So gantacurium, the most important thing is it is not FDA approved. It is not FDA approved. Next is the mivacurium. So mivacurium, it goes up to 12 to 20 minutes. So it is 12 to 20 minutes. And other thing to notice, it is FDA approved. So FDA tick. So it is FDA approved. Then let's look at the shortest acting depolarizing muscle relaxant. So what is the shortest acting depolarizing MR, that is muscle relaxant. So this will be succinylcholine. So this succinylcholine, it lasts from 3 to 6 minutes. Then we move on to the muscle relaxants having maximum duration of action. So the MR, muscle relaxants, which have the maximum duration of action. Maximum DOA, that is the duration of action. So this is nothing but doxacurium. So maximum duration of action is doxacurium. So doxacurium is the benzylisoquinoline. So benzylisoquinoline. So this will be greater than the pancuronium. So this is greater than the pancuronium, and it is the amino steroid. Now the muscle relaxants causing pain on the IV injection. So muscle relaxants which cause the pain on the IV injection site. So this will be the rocuronium. Next is the muscle relaxants which causes the placenta. So muscle relaxant cross the placenta. So what crosses placenta? It is a galamine. Galamine is the one which crosses the placenta. Now, what is the muscle relaxant which acts directly on the muscle? So there is direct action on the muscle. So direct action on the muscle will be dantrolene. And the muscle relaxant with the central action. So which has central action. So what has central action? It is a benzodiazepine. Benzodiazepine has a very central action, and also the mefenacin. So it is a benzodiazepine, mefenacin. Then there is also baclofen. So there is baclofen, there is carisoprodol. As well as metaxazole. There is metaxazole. Metaxazole. Now we will look at the muscle relaxants and the mode of inheritance. So muscle relaxants and the mode of inheritance. First is the hepatic clearance. So hepatic clearance is pancuronium. So it includes pancuronium. Then is the rapacuronium. So pancuronium, rapacuronium and the vicuronium. Next is biliary clearance. biliary clearance. So biliary clearance includes the weak uranium as well as the raw uranium. VR, weak uranium as well as the raw uranium. Raw uranium. Next is renal clearance. So renal clearance, it will include doxycurium. So there is doxycurium. Then is pancuronium as well as the weak uranium. Then comes the pipe uranium. So doxycuronium, pancuronium, weak uranium and the pipe uranium. Now the muscle relaxants which have the sympathetic stimulation. So which one has sympathetic stimulation? So sympathetic stimulation is seen in case of galamine. Galamine has sympathetic stimulation as well as the pancuronium. Now we will look at the muscle relaxants with the vagolytic activity. So which has vagolytic activity? So this includes the galamine. Then comes pancuronium as well as the rocuronium. This is mild. To learn and grow daily like this, please do subscribe.